We we love talking about these migrants, right? And I don't want to go too hard on them because man, y'all be killing them in the comments. I'm not gonna lie, y'all be killing them in the comments. But I don't want to go too hard on them. But we have to have this conversation. We gotta have this conversation. Not only is it cold for these migrants, but now it looks like in Denver they're taking over the hospitals. Let's see it for ourselves. Let's see it for ourselves.
System is now saying that it has provided more than $130 million of medical care that it still has not received payment for, with thousands of migrants contributing to that bill.
Let's repeat that. I want y'all to hear that again. Let's repeat that one.
That health system to its breaking point. The Denver healthcare system is now saying that it has provided more than $130 million of medical care that it still has not received payment for, with thousands of
$130 million that they have not gotten back, and they are not going to get it back because these dudes do not have any type of insurance, nor do they have any type of money to pay back. This is happening in Denver, y'all. Y'all thought it was bad in New York. Y'all thought it was bad in Chicago. But it seems like everywhere they go, they messing stuff up.
The migrants contributing to that bill. Joining us now with an update is Stephen Federico, Chief Government and Community Affairs Officer for Denver Health. Sir, thank you very much for joining us. First off, what exactly is happening with the healthcare in that hospital? Can somebody who's showing up right now that needs care get it?
Yeah, thank you for having us, Sandra. So Denver Health is very proud of its 160-year mission of providing healthcare to people in Denver, regardless of their ability to pay. Just to correct one fact, last year we did provide $130 million of uncompensated care, and a small portion of that is related to the recent arrival of many migrants, but the baseline for our hospital was at $130 million prior to the arrival of this population.
Okay. So we cannot blame it all on the immigrants. We cannot blame it all on the migrants. Luckily, Denver is like that, where they don't mind giving out free health care. But if you're gonna do that, at least say that. Don't make it seem like $136 million it means nothing. That means a lot. It means a lot. Let's continue.
Okay, that would be an important clarification. So you're saying that all these migrants that are showing up at the hospital are not racking up big bills?
No, they absolutely are contributing to that. We estimate that we've seen about 8,000 of these newly arrived migrants in our hospital system, from emergency rooms to primary care to dental clinics. And of course, the lack of a federal response to the healthcare needs of this population results in their inability to pay for the majority of this care. So it has contributed to our financial distress.
I might have to go to Denver and get my teeth cleaned. I'm gonna go to Denver, get my teeth clean. I'm gonna go to Denver, get my medicine. And if I'm very sick, I'm gonna go to Denver and get some surgery done. And I'm gonna take my first class flight back over to Boston. And I don't have to pay for nothing. That might be the play of 2024, y'all.
What do you think the federal government is responsible for? How should it be stepping in here?
Well, I think we need to provide basic needs to these populations. They are coming to our hospital as patients with basic healthcare needs such as respiratory illness, GI illnesses. Some of them have baseline chronic illnesses such as asthma and diabetes. We're seeing severe dental disease in the population. Some of them have acute illnesses as a result of their arduous journey, living in unsanitary conditions, drinking poor drinking water. And so we're doing the best we can from a clinical standpoint to take care of them. But we really need a system in place to help pay for that medical care, to make sure that these patients get the needed care, get the needed medication, get the needed follow-up. And the lack of a structured system to pay for that is making it extremely difficult for our clinical teams.
Where is the organization? Where is the organization from the president? Where's the organization from that state, the mayor, the governors? Where's the organization at? If you guys know this is what you guys want to do, why is stuff not set in stone before it happens? You guys are going to end up having more chaos, more deaths happen because you can't control what is actually happening. There's no organization, there's no order. And these migrants are they're coming in and they're doing what they got to do. They're going to do what they got to do to survive. And I don't blame them. I don't personally blame them for taking advantage of all the systems that we already had in place and just using it to their advantage. Kids got to get their checkups. They got illnesses that they came to the US with that they got to get that follow-up with. So it makes sense to why they would go to a hospital, go to a primary care doctor without insurance and still expect to get taken care of because they were promised that.
You say to some who might say that structured system should be our secured borders. They're coming in because they can, and they're coming in, and Texas has been inundated. Their resources are dried up. Their hospitals are overflowing. Their cities are paying a huge economic price. And so now they're going to other cities. And now this is falling in the lap of Denver. And as far as we are being told, your healthcare system is inundated.
Yeah, a huge shout out to our mayor and our federal delegation for calling on the federal government to support this population as they await additional policies that will call for their long-term viability in this country. But I do think it's important that we need to provide social infrastructure for them, places to stay, food for them to eat, and healthcare. Healthcare needs to be a key component to the response of this population.
And obviously, and that is your job, and we understand that. There's a huge economic concern. There's only so much that our system will be able to bear. And many others will have to pay for that eventually. And that is a question: where does that money come from?
I'll tell you where it's coming from. We're going to get more in debt. They're going to ask the Supreme Court to give us more money. They're going to ask the president to give us more money, put ourselves more in debt to print more money. They're going to raise more interest rates. Those are going back up. Taxpayer money. You expect your taxes to go up. And honestly, expect all the food prices, all the gas, everything is going to have to go back up in order to pay for all this. We're too far behind. We're trying to still catch up from COVID years. We haven't caught up from that, and we just going further into debt as a whole United States of America. And it's sad. It's sad because you can clearly see there's a divide. You can clearly see it.
Your mayor, Johnston, who you just referenced, he said that there's a big problem with the lack of work permits for these migrants in what he called was a broken federal system. Listen here.
It is unsustainable in the current structure. When we have 30 or 40,000 people arriving without work authorization, without federal support, it is going to be a huge strain on cities If you send us someone to Denver who has to wait 6 years for a court hearing and they can't work in the meantime, we're going to need almost endless amounts of federal support. I don't think that's what we want or the federal government wants.
So it feels like what he's pointing to is the process here. When you've got all these tens of thousands of people arriving without work authorization, without federal support, this is a huge strain on the local level of so many of these cities who have said, we welcome everyone.
Yeah, we're proud to stand.
So can you really blame the president? Or do you blame the governors? Do you blame the mayors that said we are sanctuary cities? I know some of the mayors and governors that said we're sanctuary cities, they're taking that back. They're taking that back right now. And they trying to stop them from coming in after they already got hundreds of thousands of them in. And clearly, man, clearly, it's getting worse.
Stand with the mayor in response to this humanitarian crisis, and we absolutely need additional funding to provide a sustainable infrastructure to support their path forward. I agree. I think allowing them to work is absolutely a part of the next steps that it's going to take to provide the funding. But we also need federal support in the meantime, most especially around the healthcare costs.
Yeah.
You know, our staff are being asked to staff up, see extra patients, and then, you know, the moral strife that comes with discharging a patient, not knowing if they're going to have the money they need to fill that needed prescription, find transportation to a follow-up care, come back for additional care. It's extremely strenuous on our staff, and I really feel for them.
Do you have any doctors who are saying they just can't do it anymore, that it's just too much? I mean, is there staff that are saying that they're leaving?
No, our staff are very proud to fulfill the mission of Denver Health, to provide care to everyone, regardless of their ability to pay. Very much responding to the humanitarian crisis of these patients.
We understand.
But we're going to need additional support to do it, and to do it well.
And have you had to turn away any patients?
He's so nice. They're so nice in Denver. They're so nice. Is Denver nice like that? I've never been to Denver, so I know I watch the Nuggets. I like the Nuggets. But is Denver that good? Is Denver that nice? They're so loving over there. I feel like I want to go visit there, honestly. Like I feel like I belong there, kind of. They're so nice. You get free healthcare. The workers over there are dedicated to the healthcare community. They're dedicated to the healthcare results that everyone is looking for. They want free healthcare, regardless of if you can't afford it or not. They want to shelter you. They want to make sure that you're fed. And they want to make sure that you can get your prescriptions filled. They're so nice over there compared to everywhere else that has these migrants there. Denver is actually still for it, it seems like, which is very interesting. Very, very interesting.
No, so we'll always see patients, most especially through the emergency department, which is where we're seeing the vast majority of these patients currently.
Oh, okay. So because the headline everywhere right now is that you've had to turn away patients. Is that not the case?
No, we always see patients through the emergency department, regardless of their ability. Now, our ability to see them in follow-up is extremely limited based on physical capacity and the lack of resources to do so.
Understood. We thank you for your time, sir. You have a huge task at hand. Appreciate your time. Thank you very much.
Thank you for covering the story. Appreciate you.
I'm Steve.
That was interesting, for real. It looks like Denver is the place that the migrants want to be at this particular time. They don't have to worry about the cold wind. They don't have to worry about the snow in the windy city. They don't have to worry about the New York rats. They just got to come in and do what they got to do and be good citizens, or good migrants, at least. It's a beautiful thing in Denver. And I wish them luck over there. Pray for the migrants, man.